During the pandemic, everywhere the focus was more on the disease at hand, which is COVID-19, and other diseases seem to have taken a backseat in the process, even a disease as serious as cancer, which is why it is important to talk about diseases such as cervical cancer. Today, we have with us Dr. Neha Kumar, Senior Consultant, Gynae-Oncology, BLK Max Super Speciality Hospital, to understand all about cervical cancer. Hello, doctor.
Hi, hello, namaste.
First of all, help the people watching understand what exactly is cervical cancer.
Right, and that's a very important question because a lot of women and a lot of people in our country don't even understand what cervix is, and they sort of think cervix is uterus only. So cervix is basically the opening of the uterus into the vagina or the birth canal. And cervical cancer happens when there are abnormal cells of the cervix which grow out of control. And this is different from uterine cancer. So it is important for us to realize that this is a different cancer. It is a preventable cancer. And unfortunately, in India, it is the second most common cancer.
Okay. And cancer cases somehow seem to be increasing during the pandemic. Immunocompromised patients are considered vulnerable to diseases like such as cervical cancer. Has it in any way affected patients suffering from cervical cancer, or have you seen more cases being reported during this period, the pandemic?
So the COVID-19 is actually, you're right in the way that it affects immunosuppressed people more. Having said that, generally it's a limiting disease which generally resolves in 7 to 14 days. So it would not have any bearing on the progress of the disease, but because of the COVID pandemic, less number of women have been coming for their screening, their pap smears. So that way our screening programs for cervical cancer we would be organizing camps in in the communities around for pap smears, and that has taken a backseat, and basically the women have not been able to come forward to get themselves screened. So yes, the screening part has been affected, but like I said, immunosuppression, although you are right in a way that cervix is immunosuppression is a risk factor for cervical cancer, but COVID-19 per se does not really affect the progress, either the deterioration of the disease. Our main problem has been the women coming to the screening.
Yes, because I think that COVID-19 as a disease has led to a lot of confusion also. Like people are not able to understand what is there is so much information that people are not able to understand, like what is exactly COVID leading to, if it's actually a risk factor in diseases like cancer. So do you have something to say about
Yeah, so see, what happens is there are both sides of the coin. Immunosuppressed people, elderly people are more prone to develop severe form of COVID disease, and that's why they are the vulnerable group. But once a patient is infected, our immunity sort of takes care of the infection. And patients who have severe disease, basically, they have the cytokine storm, which is an overactive form of immunity, which is, causing problems. So per se, the disease itself does not lead to immunosuppression. It would not lead to cancer, or it would not increase the incidence of cancer. But yes, because overall, the patients coming to hospitals for normal checkups for their normal gynae problems, that has reduced. That is why lesser number of women are coming to get themselves screened or to get themselves checked for some common gynecological complaints, which if detected in time can be treated promptly.
Okay. So HPV is the leading factor, if I'm right, that
Yes,
causes
right.
cervical cancer. So can you explain how it is a risk factor?
Yeah. So cervical cancer, basically the causative agent, these are high risk HPV. HPV is basically stands for human papilloma virus, and it is present in almost all of sexually active adults. But most of us are able to clear off this infection with our immunity. In a few percentage of patients, the virus is not cleared off, and in such women over a long period of time, this can lead to persistent HPV infection with high risk types. and the most important of this are 16 and 18. So persistent infection over a long period of time leads to cervical cancer. So this is the causative agent. There are some associated risk factors along with HPV. For example, early marriage, having multiple pregnancies, multiple partners, poor genital hygiene, malnutrition, smoking, immunosuppression, immunosuppressive diseases like HIV infection, and most importantly, the lack of awareness about this disease and the lack of women coming regularly for screening. So that is the main important cause for having such huge numbers of cervical cancer in Indian women.
Yeah. So, are there any HPV tests available that people should know about? Because there's a lack of awareness about it. So, can you throw
Right.
some light on the topic and what could be done to make people aware of it?
Right. So before I move to HPV tests, I would start with what we do as a routine protocol for screening of women. So
Okay.
all sexually active women between the age of 21 to 65 years of age should be getting themselves screened for cervical cancer. And this is normally done via two tests. One is pap smear and the other is an HPV test. So between 21 to 30 years of age, we recommend the women come for a pap smear once in every 3 years. And above 30 years of age, that is between 30 to 65, the women can get themselves screened either with a pap smear once in 3 years or a pap smear and an HPV test combined, that is known as a co-test, once in every 5 years. So HPV test is not recommended in women who are less than 30 years because, like I told you, most of the sexually active young adults harbor this infection, and most of this infection gets cleared off on its own. So below 30 years of age, HPV test is not recommended. It is generally recommended above 30 years of age. So uh, the HPV test has a greater sensitivity than a pap smear. A single pap smear has a sensitivity of about 60 to 70%, whereas a single HPV test has a sensitivity of 90 to 95%. When we combine the two together, then it has a very high predictive value. So it can pick up cases with much greater sensitivity. Therefore, the screening interval gets prolonged from 3 years to 5 years. So normally the way to do an HPV test, or rather to start with, the way to do a pap smear is basically during a gynecological checkup. It's a painless outpatient procedure where with a brush we collect some cells from the cervix and see under the known as a pap test. And with pap test, we also collect material which is basically used to test for HPV, the genetic material of the HPV known as DNA, HPV DNA. So that tests for high risk HPV. And this is, like I said, once we do this with the pap test, this is done once in every 5 years. So this is basically how the screening goes.
Yes. Okay. So we hear about cancer patients everywhere around us. Who is a typical person who can get cervical cancer? Is there a particular habit that leads to or underlying problem that could lead to this disease?
Okay. So because cervical cancer, the causative agent for cervical cancer is human papillomavirus or HPV, which is present in, like I said, in all sexually active adults. So all sexually active women are prone to develop this cancer, in the sense that, yes, most of them will acquire HPV infection. A vast majority, that is 95 to 98%, will clear off this infection with their immunity. A few percentage of women will not be able to clear this, and when it persists over a long time, then it leads to pre-cancer and then to cancer of the cervix. So we cannot differentiate as of now who is likely to clear this infection off or who is not likely to clear this off. Therefore, all women between 21 to 65 who are sexually active should be getting themselves screened. Like I said, the risk factors are early marriage, multiple sexual partners, multiple pregnancies, poor genital hygiene, malnutrition. Unfortunately, in India, this disease is seen more so in a lower socioeconomic strata because these women are prone to malnutrition. They do not have access to good genital hygiene. They don't have the knowledge. They don't have the awareness. That is why we get more women from the lower socioeconomic strata, and more often they come in advanced cases. And certain immunosuppressive diseases like patients with HIV infection are more prone to cervical cancer.
So So are there any lifestyle factors, would you say, like smoking or alcohol, that play a role here?
Smoking does, yes. Smoking, basically what happens is the smoking, it suppresses the immunity, it suppresses the clearance of the HPV virus. So there are certain cells which are certain cells of our immune system which are responsible for clearing of viruses, and smoking inhibits those. So smoking over a long period increases the chance of this cancer. Alcohol is not directly related to cervical cancer, not to cervical cancer.
We've already talked about the tests. So what are the treatment options available for cervical cancer patients?
Yeah. So let me begin with what the patients present with. So most common symptoms, most common symptoms of this disease are irregular bleeding. So a woman may come with intermenstrual bleeding, that is bleeding in between her periods, bleeding after sexual intercourse, or bleeding after she has attained menopause. Or she may
Mhm.
come with foul smelling discharge which has been persisting for some time. So these are the common symptoms. And once such patient comes to us, we examine her thoroughly, we take a history, and if we find a growth on the cervix, we take a biopsy, which is an outpatient procedure, and we send it for histopathology. After that, we also do a certain imaging. Imaging is basically to see how far the disease has spread. So the stage of the disease is decided both on clinical examination, which we do in our gynae OPDs, as well as through imaging techniques like MRI, and sometimes we use higher imaging screening like PET-CT, where we suspect that the disease is advanced. So once we know what is the stage of the disease, in early stage, I mean stage one. So stage, basically, the disease which is confined to the cervix is stage one. The disease which has spread beyond the cervix but has not gone up to the pelvic wall is stage two. The disease which has spread right up to the pelvic wall, or it has affected the certain glands of our body. These glands are known as lymph nodes. So these are small glands which are present adjacent to the blood vessels. They are present in all of us. So if any lymph node is involved, either in the pelvis or in the abdomen, that makes it stage 3. Stage 4 is divided into two parts, 4A and 4B. 4A is when the cervical disease has involved the bladder in the front or the rectum behind. 4B is when it has spread beyond to involve distant organs, or has metastasized or spread to different organs of the body. So the treatment of this disease depends upon the stage. So once we determine that these are small stage 1 cancers, they are amenable to surgery, and the surgery is known as radical hysterectomy. So this is different from a simple hysterectomy, which is done for benign conditions like, say, fibroids. So in radical hysterectomy, we remove not only the uterus and the cervix, but the adjoining tissues, as well as the upper 1 to 2 centimeters of the vagina. Also, with this, we remove the lymph nodes present in the pelvis. So this surgery is quite radically different from a simple hysterectomy, which is done for a benign condition. When the disease is in stage 2 or stage 3, then we normally treat it with radiotherapy. With radiotherapy, we also give a small dose of chemotherapy to increase the effects of radiation. So radiation includes both external radiotherapy as well as internal radiotherapy. And this is a treatment which generally lasts about 1.5 to 2 months. A disease which has spread beyond, if it is in stage 4, normally we start treating the patients with chemotherapy first, downsize it, and then take it forward. So the survival rates also depend upon what the stage is. So normally in stage 1, the survival rate is good. It's about 85 to 90%. As we move to stage 2, it is 75%. Stage 3 is about 50%, and stage 4 is about 15 to 20%.
Okay. We know that cancer doesn't show symptoms in the beginning of the disease. So what would you
Correct.
suggest? So the only option left with people, with women, is to get a regular checkup, right? Or
Correct.
are there any
Yes.
other signs they can notice, or something that can help them understand that how the disease shows itself in the beginning?
Correct. So you're very right. Basically, the screening, the whole idea of screening is to pick up cancer before it has occurred. So it detects cancer either in the pre-cancerous stages or in the early stages when it is amenable to treatment. So the first thing is to get yourself screened once in every 3 to 5 years, depending upon whether you're doing a pap smear or you're doing a pap smear and an HPV. Secondly, what we can do is basically there are vaccines available now. These are known as HPV vaccines. So these vaccines cover two important high risk HPVs, that is 16 and 18, and they also cover two other variants, that is 6 and 11. So it basically covers 70% of the cancers which are caused by HPV 16 and 18, and it also prevents infection against genital warts, which are basically caused by HPV 6 and HPV 11. So this vaccine is recommended for adolescent girls around between 11 to 13 years of age before the onset of sexual activity. And once they are administered to this group, the efficacy rate is almost 95 to 98%. It can be given even up to women up to 26 years of age. Although the US FDA has approved this vaccine for women up to 45 years of age, but we need to understand that after a woman is sexually active, the role of this vaccine is less. So this is basically what we in medical terms call a prophylactic vaccine, that is to prevent HPV infection. Once a HPV infection has already occurred, this vaccine will not treat that HPV infection. That HPV infection has to clear off on its own. If we give this vaccine to a woman who's, say, 30 years old, married, sexually active, the role of this vaccine is mainly to prevent reinfection of HPV. So, whereas the efficacy of this vaccine in a young adolescent girl is 95 to 98%, in a woman who's already sexually active, the efficacy drops to 40 to 45%. At the same time, it is important to know that even if a girl is getting the HPV vaccine in her adolescence, we should know that this vaccine, as of now, covers only 70% of the 70% of the cases of cervical cancer. So 16 and 18, these two strains cause 70% of the cervical cancers. It doesn't cover the remaining 30%, number one. Number two, it is important for a girl who is vaccinated after she gets married or is she's sexually active, then after 21 years she should still be getting a pap smear and an HPV test. It doesn't mean that she has received HPV vaccination so she will never develop cancer. This idea is wrong. So HPV vaccine is definitely a means of prevention, and young adolescent girls should be administered this vaccine. But having said that, as of now, after they become sexually active, it does not obviate the need for pap smear and an HPV test at the age of 65. And the other preventive factors are adopting a good lifestyle, maintaining a good genital hygiene, all this. So basically, keeping if you're diabetic, keeping your sugars under control. All this leads to immunosuppression. So these are small factors which can be done, but main thing is getting yourself screened. And HPV vaccination will go a long way in reducing the cancer burden in the years to come.
Okay. Though you've already mentioned the preventive measures, can you please walk us through it once again so that people, for the audience that are watching?
Yeah, sure. So the preventive measures are A, awareness or knowledge. Know what cervical cancer is. Know that it is a very preventable disease, and unfortunately, it in India, because the women are not getting themselves screened, it is being found in advanced stages, and we it's the second most common cancer in Indian women. So A, know what is a cervical cancer. B, get yourself screened starting from the age of 21 or at the onset of sexual activity from 21 to 65 with either a pap smear or a pap smear and an HPV. Young adolescent girls should be administered HPV vaccine. Below 15 years of age, two doses are required, and above 15 years of age, three doses are required. As of now, no boosters are recommended for this vaccine. And thirdly, maintain a good lifestyle, maintain proper genital hygiene, eat nutritious food, get yourself screened. It's a very preventable cancer. Unlike other cancers, there are many cancers which are not preventable, where the screening doesn't work. Unlike those, this cancer is very much preventable provided we get ourselves screened. The difference between India and the West is that in West we have regular screenings. That is why it is very uncommon to find cervical cancer among the Western population. In India, because the women don't come for screening and because of the vast population we have and we are not able to reach all women, this cancer is found in advanced stages where it may not be amenable to curative treatment.
Okay. That were all my questions. Thank you so much for joining us today. And thank you for giving us your time.
Yeah, my pleasure.
Thank you so much, Doc.
Yeah, my pleasure.